CNS infections. We're going to be talking about meningitis and encephalitis. Let's start with meningitis. What are the meninges? The meninges are the coverings. The meninges are the coverings around the brain. We have three layers of meninges: dura mater, arachnoid mater, and pia mater, which is so intimate to the brain. When a CNS infection is suspected, you need to do head CT. You need to do head CT before doing lumbar puncture. Now, meningitis is going to present with headache, neck rigidity, and fever. Subarachnoid hemorrhage also is going to present as headache, neck rigidity, and fever. Therefore, you need to do head CT to exclude subdural hemorrhage. And especially in history of CNS disease, you have to do CT. Focal neurologic deficit, you have to do CT. Presence of papilledema, increased pressure in the eye, CT. Seizures, you have to do CT. Altered consciousness, you have to do CT. Significant delay in the ability to perform lumbar puncture. So always try to start with a CT before doing lumbar puncture. And also get blood cultures and start empiric antibiotic therapy even before the head CT. So here will be the sequence of events. You have a patient in the ER presenting with headache, fever, neck rigidity. Headache, fever, neck rigidity. What to do first? Get a blood culture, take a blood sample, and start empiric antibiotic therapy right away, and then prepare for an urgent head CT, and later on you're going to do lumbar puncture. If the CT excluded hemorrhage, then you will do lumbar puncture. So antibiotics, head CT, lumbar puncture for meningitis. So a 45-year-old man comes to the ED with fever, headache, photophobia, and neck stiffness. No focal neurologic deficit and no altered level of consciousness. What is the next step? If there is no loss of consciousness and you're kind of more comfortable that this is not one of the indications for a head CT, you can go straight ahead to lumbar puncture, but you have to start first the antibiotics as we mentioned. So the most accurate test for bacterial meningitis is, of course, to retrieve the organism, to culture the organism from the CSF. But usually when we do lumbar puncture and we take a CSF, it's very easy. It's easier to do a CSF cell count. It's easier to do a CSF cell count. It's not very specific, but it's available sooner than the culture. The cell count with the differential is more specific than elevated CSF protein level. What do you expect to see in CSF cell count? You would expect to see thousands of neutrophils, neutrophilia, too much neutrophils in the cerebrospinal fluid. And then you will definitely be able to culture an organism. And we will also have elevated protein level in the CSF. As a matter of fact, a normal CSF protein level can exclude bacterial meningitis, because what are bacteria? They are living organisms very rich in proteins. So when you have a lot of bacteria in the CSF, you will have a lot of proteins in the CSF. And these bacteria will consume the glucose in the CSF. They are going to be feeding on it, so we get low glucose levels. Elevated proteins, low glucose levels, and more importantly, elevated neutrophils are the CSF findings in bacterial meningitis. Encephalitis, which is brain substance infection. Here we have infection of the brain substance itself, not only of the coverings. And usually it is viral in origin. And the manifestation is fever and altered mental status over few hours. Fever and altered mental status over few hours. Notice, if the infection extends to involve the meninges, you will also get the manifestations of meningitis, which are headache and neck rigidity. If the patient has still, as I said, has photophobia and stiff neck, you will not be able to diagnose encephalitis because the picture is going to be confusing with meningitis. Almost all encephalitis in the United States is caused by herpes, viral herpes virus. The best initial test is head CT scan, and the most accurate test is PCR of the CSF to retrieve this causative virus. And the treatment is acyclovir for herpes, and for acyclovir resistant patients we do foscarnet.